Hello and welcome to this informative video on the male and female reproductive system. Our reproductive system plays a crucial role in the continuation of our species, and it's important to understand the anatomy and functions of this complex system. In this video, we'll be exploring the differences and similarities between male and female reproductive organs, as well as the processes involved in reproduction. By the end of this video, you'll have a better understanding of the fascinating workings of the reproductive system. So let's get started. Section I. Male reproductive system. The male reproductive system is responsible for producing and delivering sperm for fertilization of the female egg. It's made up of several organs and structures that work together to create and transport sperm. A. Anatomy of the male reproductive system. The main organs of the male reproductive system are the testes, epididymis, vas deferens, seminal vesicles, prostate gland, urethra, and penis. The testes are the primary reproductive organs and are responsible for producing sperm and testosterone. The epididymis is a long, coiled tube where sperm mature and are stored. The vas deferens is a tube that carries sperm from the epididymis to the urethra. The seminal vesicles and prostate gland produce fluids that mix with sperm to create semen. The urethra is a tube that carries semen and urine out of the body. The penis is the external organ that delivers semen during ejaculation. B. How sperm is produced. Sperm is produced in the testes through a process called spermatogenesis. It takes about 72 days for a sperm cell to mature from a germ cell. The mature sperm then move through the epididymis where they gain the ability to swim and fertilize an egg. C. How sperm is delivered. During sexual intercourse, sperm is ejaculated from the penis into the vagina. From there, the sperm swim through the cervix and into the uterus. If an egg is present, the sperm can fertilize it, leading to pregnancy. Section 2. Female reproductive system. The female reproductive system is responsible for producing eggs for fertilization and providing a nourishing environment for a growing fetus. It's made up of several organs and structures that work together to create and transport eggs. A. Anatomy of the female reproductive system. The main organs of the female reproductive system are the ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries are the primary reproductive organs and are responsible for producing and releasing eggs. The fallopian tubes are where the egg travels from the ovary to the uterus. The uterus is where a fertilized egg implants and grows into a fetus. The cervix is the lower part of the uterus that opens into the vagina. The vagina is the external opening that receives the penis during sexual intercourse. B. How eggs are produced. Eggs are produced in the ovaries through a process called oogenesis. It takes about 28 days for a single egg to mature and be released from the ovary. C. How fertilization occurs. During sexual intercourse, sperm is ejaculated from the penis into the vagina. The sperm then swim through the cervix and into the uterus, where they may encounter a mature egg. If a sperm cell penetrates the egg, fertilization occurs, leading to the formation of a zygote. Section 3. Common reproductive issues and treatments. As with any bodily system, the reproductive system can be susceptible to issues and disorders. Both men and women can face a range of challenges related to their reproductive health, including infertility, sexually transmitted infections, and reproductive cancers. Let's take a closer look at some of the most common issues and their treatments. A. Infertility. Infertility is defined as the inability to conceive after 1 year of unprotected intercourse. In women, infertility can be caused by a range of factors, including ovulatory disorders, blocked fallopian tubes, and uterine abnormalities. In men, infertility is often caused by issues with sperm production or function. Treatments for infertility may include medications, surgery, or assisted reproductive technologies such as in vitro fertilization, IVF. B. Sexually transmitted infections, STIs. STIs are infections that are spread through sexual contact. Common STIs include chlamydia, gonorrhea, and human papillomavirus, HPV. Left untreated, STIs can lead to serious health consequences, including infertility and reproductive cancers. Treatment for STIs typically involves antibiotics, antiviral medications, or other prescription drugs. C. Reproductive cancers. Reproductive cancers can affect both men and women. In women, reproductive cancers can include cervical, ovarian, and uterine cancer, while in men, they can include testicular and prostate cancer. Treatment for reproductive cancers may involve surgery, radiation therapy, chemotherapy, or a combination of these treatments. Remember, the key to maintaining a healthy reproductive system is to practice good habits such as practicing safe sex, getting regular checkups, and maintaining a healthy lifestyle. If you have concerns about your reproductive health, don't hesitate to speak with your healthcare provider. Section IV, Reproductive System Disorders and Conditions. While the reproductive system is essential for the continuation of the human species, it is also susceptible to a range of disorders and conditions that can impact fertility and overall reproductive health. Here are some common conditions that affect the male and female reproductive systems. A. Male reproductive system disorders. 1. Erectile dysfunction, also known as impotence. This condition refers to the inability to achieve or maintain an erection sufficient for sexual intercourse. 1. It can be caused by a variety of factors, including underlying health conditions, psychological issues, or certain medications. 2. Testicular cancer. Testicular cancer is a relatively rare but highly treatable form of cancer that affects the testicles. 2. It is most common in young men and may present as a lump or swelling in the testicles. 3. Prostatitis. Prostatitis is an inflammation of the prostate gland, which can cause pain and discomfort in the pelvic region. 3. It can be caused by a bacterial infection, but in some cases, the cause may be unknown. B. Female reproductive system disorders. 1. Polycystic ovary syndrome, PCOS. PCOS is a hormonal disorder that affects women of reproductive age. 1. It is characterized by the presence of cysts on the ovaries, irregular periods, and high levels of male hormones. 1. PCOS can lead to fertility problems and other health issues, such as type 2 diabetes and heart disease. 2. Endometriosis. Endometriosis is a condition where the tissue that normally lines the uterus grows outside of the uterus, causing pain and discomfort. 2. It can also lead to fertility problems and is often diagnosed in women who are struggling to conceive. 3. Uterine fibroids. Uterine fibroids are non-cancerous growths in the uterus that can cause heavy menstrual bleeding, pain, and discomfort. 3. They are most commonly found in women over the age of 30 and can sometimes interfere with fertility. C. Reproductive health and lifestyle factors. Reproductive health is a vital aspect of overall well-being and quality of life. Maintaining good reproductive health is important not only for the ability to have children but also for overall physical and mental health. Many lifestyle factors can impact reproductive health, so it's essential to be mindful of them and take appropriate measures to support your reproductive system. Diet and nutrition. 1. Diet and nutrition play a significant role in reproductive health. 1. A healthy and balanced diet that includes a variety of fruits, vegetables, whole grains, lean protein, and healthy fats can provide the nutrients and antioxidants necessary for reproductive health. 1. Vitamins and minerals such as folate, iron, zinc, and vitamins C and E are particularly important for reproductive health. Exercise. 1. Exercise is crucial for overall health, including reproductive health. 1. Regular exercise can help maintain healthy body weight and reduce the risk of chronic diseases such as diabetes and cardiovascular disease. 1. It can also help improve blood flow, reduce stress, and increase overall energy levels, which can benefit reproductive health. Sleep. 1. Getting enough quality sleep is essential for reproductive health. 1. Chronic sleep deprivation can interfere with hormone production, which can impact reproductive health. 1. Sleep is also necessary for the body to repair and regenerate tissues, including reproductive tissues. Stress management. 1. Chronic stress can have a negative impact on reproductive health. 1. It can interfere with hormone production, disrupt menstrual cycles, and reduce libido. 1. It's important to find healthy ways to manage stress, such as practicing relaxation techniques, meditation, or yoga. Environmental factors. 1. Environmental factors such as exposure to chemicals, toxins, and pollutants can also impact reproductive health. 1. Exposure to pesticides, lead, mercury, and other chemicals can impact hormone production and reduce fertility. 1. It's essential to be mindful of environmental factors and take appropriate measures to minimize exposure. By making lifestyle changes that support reproductive health, you can reduce the risk of reproductive issues and improve your overall quality of life. It's important to consult with a healthcare professional if you have concerns about your reproductive health or are experiencing symptoms of reproductive issues. Taking care of your reproductive health is crucial for overall health and well-being, so don't neglect it. Conclusion. In conclusion, the reproductive system is a complex and essential part of human anatomy. Both the male and female reproductive systems have unique structures and functions that work together to facilitate the creation of new life.